All right.
Oh god.
Since we can't have rotators next year,
No,
we're trying
I'm
to get
not
a
ready.
good feeler for our department.
I
That's
haven't
the
been
whole point.
Thinking about this.
All right, Dr. Brandt. Introduce yourself. Tell me what year you are. What fancy new position you hold in the department now.
All right. So
Where are you from?
I'm from Atlanta, Georgia. One of the current second years, and just recently got elected chief. So very excited to have that role next year.
And what shift are you on right now?
Right now on a resus shift.
You just walked away from the bedside. How's it going?
It's going really well. We've got, not too crazy today, but some sick patients here. Just trying to work up some undifferentiated ultra-mental status. The patient.
What's new?
Yeah.
All right, so like I said, students won't be able to rotate here next year, so we need you to portray to them what interested you in this program, what drew you to this program.
Absolutely. So when I was in med school, my wife and I were both couples matching, so that was kind of definitely a big component that came in. But I spent 4 weeks down here on a medical student rotation, and just was absolutely amazed by how efficient and competent the third years were when I was watching them. Had the skill sets of some of the, almost attending level skill set by that point, ready to go out and practice on their own, and felt very comfortable doing so. That was just really impressive to me. There's a lot of incredible pathology, and you get put in some situations that can kind of challenge you to become a better clinician.
Now, we want to be open and honest because one of the best parts of rotating places is seeing why you may not want to go somewhere. So to you, when you leave a shift or when you're leaving next year, what are some things you're going to look back on and be like, you know what, I don't miss that? Or maybe are really tough things you've experienced in our program?
Absolutely. So, sometimes we are, we have some limited resources here. I think we do an incredible job of providing great care despite those limitations. But sometimes, it can be difficult in our, we have a pretty crowded department. A lot of times you will be right next to your patients at all time. They can always, walk up next to you and ask you a question at any point, any shift. Sometimes that can get a little frustrating. But it is nice because you can also keep an eye on all of your patients. You can look around the department at any point and see, all 10 of your critically ill patients and what they look like on the monitor, etc. So.